and final Myeloma Monday. I'm super sad to see this month go away. During Myeloma Awareness Month, HealthTree released a lot of tech tools which were very exciting. One of them was a clinical trials finder where patients can see their personalized list of clinical trials that they qualify for. Another one that I loved as well was Leave, our AI assistant that patients are using now to find the information they want within HealthTree and be empowered as myeloma patients. The other cool one was our app now that you can use with your cell phone and access all your HealthTree tools. And we also talked about the perspective that doctors have on medical data, which was very interesting. And today we're talking about the magic behind the scenes. My name is Ana Sagun. I'm Director of Patient Experience and Clinical Data Management, and with me is...
Hi, I'm Mariana Castro, Data Integrity Manager at HealthTree.
Thank you, Mariana. I'm very excited to be here with you today. So the magic behind the scenes basically means everything that happens behind Cure Hub, so all of the data can be used. But the expert here is Mariana. So Mariana, can you tell us more about it? What does that mean?
Oh, that's a great question. Do you have time?
Of course, I have a lot of time.
So the magic behind the scenes, also known as hard work, a lot of hard work, is actually a wonderful team of medical doctors, software engineers, and data experts that they are in charge of extracting all the information from medical records and making available for the patient's portals and research.
Okay, that is very interesting. Could you explain a little bit more?
Sure.
Okay.
Okay. So, you know, when a patient visits their doctor, their medical team records everything what happens during the visit, you know, from vital signs, a physical exam, any labs, procedures, or prescriptions that are given during the visit. And all of this is stored as documents, and this is called electronic health records. So the real magic happens when the patients decide to connect their records to HealthTree. We get like a temporal copy of these records, and this wonderful team that I just mentioned manually extracts all this information from the PDFs and save this information in standard codes to be able to be used in research and in the patient portal.
Okay, so basically, a patient goes to their appointment. Their care team puts all their information in their EHR. Sometimes it's just words in like PDF, like paragraphs and so on, and sometimes they do structured data, right? So we get both, and our team reads all the unstructured data, make sure that the structured data comes correct, and then structures. It's a lot of structure words. Structures all the unstructured data in our database.
Yes, correct. So yeah, structured data includes information that is already stored in standard codes, like international standard codes.
Okay.
And then just the unstructured is just full PDFs, text and more text to read and interpret.
Okay, can you tell me a little bit more about these standard codes?
Yeah, we have, these are basically to ensure that medical information is recorded consistently across hospitals and across all the country. And we have standard codes for everything. You know, we have codes for diagnosis, we have codes for imaging, for labs, for procedures, for everything. There is a code for everything. So yeah, make sure that we are comparing apples to apples, you know, when managing information.
Yeah, that makes sense. So when the team gets all these documents, they can go in an organized way. And I've heard, talking about documents, that you guys have gotten a large amount of documents sometimes. So which has been the craziest number?
Take a guess. What do you think is the largest number that we've got?
So, I don't know, 200 for one patient.
we've gotten 1,900 for one patient.
1,900 documents for one patient. So reviewing all that, reading all that, manually adding it, that's crazy. That's a lot of work. Yeah, definitely. Okay, and what type of data do you work with? I mean, you've talked about it already, but
yeah, we work with everything. We work with diagnosis, with treatments, with labs, genetics, any information.
so everything.
Yeah.
Everything that gets captured during the patient's visit.
Yeah.
Okay, that's outstanding. All right, and then probably we should share with the audience how long it takes to validate one of these patients' records on average. We use the word validate because we just make sure that it's correct and we enter all the information within the patient's record.
Yeah, so to validate one patient, it takes about 7 hours.
Yeah, on average.
Yeah,
That's a lot. That's a lot because we're getting more and more patients joining HealthTree, so we definitely need to be faster. All right, but
That's why we're here today.
that's why we're here today. Awesome. Should we show them?
Yeah.
Okay.
So we are very happy to share this new tool that our engineers just developed for us to capture the medical information in a quicker way. So we basically get just full documents. And this new tool that is going to use artificial intelligence to help us extract the most relevant parts of the note. For example, this is a note, it's a Jenny's note. So we can have diagnosis. We have a lot of information in the same note. So this tool is going to help us highlight what's relevant for us.
Okay.
So as you can see, we have diagnosis, multiple myeloma, and then the tool here on the right is suggesting that we use multiple myeloma, and also it's suggesting the code that I just mentioned.
That's the standard code that you were talking about. So multiple myeloma has one code only.
Yes,
Right?
yeah. So it suggests the code that we can use. So our doctors will go and just check mark here to make sure that the information is correct. So if there is something that shouldn't be here that the AI is suggesting that is not in the node, we wouldn't add it, or we would modify it so it's correct. So it will take medical validation as well, but this is going to be way faster with.
Right, because instead of reading the whole document, you guys are just gonna go to the highlighted information.
Yeah.
And a quick disclaimer here, Jenny was okay with us sharing this record from here. Oh yeah, okay. So what else do we get here?
Yeah.
Procedures.
So for this tool, we're doing diagnosis, procedures, and medications. And we're also working on a AI tool to extract genetics, which is a bit more complicated. It requires medical interpretation that our doctors do right now manually.
Right.
But our team is training a new tool to help us extract this information faster. So
because genetics are super complex, right? I think that's it.
yeah, and super important.
It's super important, yeah, especially myeloma.
Yeah, so we have a couple of examples here. This is a procedure, example of procedure, appendectomy, and then it's suggesting that we use appendectomy. So I check mark here, and then we have also treatments, as I mentioned, and we will go and check this if they're correct.
Lovely.
Yeah, so that's our new tool. We're happy to use it.
Of course, because and when our team checks that, then it's going straight to medical record. And as I was looking at this, I was thinking, okay, it looks very simple, but by working with your team, I've noticed that sometimes there are a lot of codes, similar codes, you can get, I don't know, different types of vitamin D, right? So it's very important to know which one we're actually measuring and get the right code. So health data, it's definitely not easy to work with. It's very complex. So I'm very excited that our team is working with, and it just making all these tools to make it easier. All right. So anything else that you would like to add about this?
I can't wait until the genetics part is ready. I know this is going to be amazing, and it's going to help us a lot to validate patients' data.
Yeah, definitely. I'm very excited, and I'm super excited to see how fast this is gonna be, and our process is gonna get way faster. So this is something that patients cannot see directly, but this is what happens behind. And all the tools that our team is working on are gonna help accelerate this process. Once this data is structured in HealthTree, then it can be used by our patients to use all the tools that we have, like the clinical trial finder, to get a personalized list on the clinical trials that you qualify for, find your myeloma twin, and then you can help accelerate research by joining HealthTree, and of course help us find the cures of tomorrow, which is definitely very, very exciting. One thing that I would like to add as well, remember when you share your data, and if we share it with researchers, that comes as anonymized data, unless you're joining a specific study where you give a special consent. But we're very, very careful with the data. So that's something else to add. Well, I think this is it. This is the end of our Myeloma Awareness Month. We had a lot, and we released a lot of cool stuff during this month. I'm very excited, but it doesn't stop here. Our team is working at a fast, very, very fast pace, developing more tools for your benefit as patients and for our benefit, so we can accelerate research and use this information in a useful way, right?
Yeah.
Okay, well, thank you everyone.
Thank you for joining.
See you next year, I guess.